Is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is January 20th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the webinar, The Self-Directed Person-Centered Plan, Process Rates, and COLA for Participants and Families. Our presenters for today include Bernie Simons, the Deputy Secretary for DDA, and we also have Dr. Yamonja Smalls, Coordinator of Community Services Director, Ron Peel, DDA's Finance Director, Jonna Hitch, Director of Self-Determination from the Eastern Shore Regional Office, Tina Swink, Waiver Coordinator and Self-Directed Services Coordinator, Rhonda Workman, Director of Federal Programs, and Marianne Kane-Bresci, Director of Family Supports. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone, and if you look at the panel interface on your right labeled audio, you can click either computer or phone to switch for the best option. There's a handout for the webinar, and it is in the handout section in the panel to your right. They can also be emailed upon request. We will be recording the webinar and posting it on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will answer those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and thank you. And thank you for everybody who's participating on this webinar today. And I know it's the 20th of January, but I still want to wish everybody a happy new year and hope that everybody is staying safe and healthy. And I also want everybody to know that DDA is committed to the success of self-directed services in Maryland. And we will continue to work with participants, families, advocates to increase participation. The number of folks who participated in self-direction, we went back and looked at this and basically started in calendar year 2006. And at that point in time, we only had 41 individuals that basically were self-directing their services. And, as of today, just showing the growth and, the way people appreciate self-directed services, we've got over 1,500 people who are self-directing their services. And this growth basically occurred starting in 2013, when the new directions waiver was merged into the community pathways waiver. And I thought that was just an interesting point. But again, to go from 41 in 2006 to over 1,500 today is just remarkable. So our goal is to offer all our Medicaid participants more choices about how to get your supports through the home and community-based services. And DDA really believes that self-direction can be for everyone, and want to make sure that our services are all-inclusive so that there's a solid understanding of self-direction, because I've heard that some entities within our DDA community basically don't totally understand or appreciate how great a self-direction can be. And again, we want to make sure that everybody who is self-directing their services succeeds. And then knowing that when you self-direct your services, you basically have a lot of control and choice, flexibility, and responsibility that you may not have if you were in traditional services. So again, we want to make sure that when you decide what services you want and what you purchase through your budget is going to meet your needs. I hear a lot from folks about how wonderful a person is doing in self-direction. A lot of testimony that we've seen, a lot of discussion with people who are self-directing, and that it's not just the individual who's self-directing, it's the family and the siblings that are seeing their family member be able to grow and learn and have all of this flexibility. So beginning in this month through June 30th, DDA will coordinate with the case management entities, our CCS agencies, to ensure that all self-directed participants have a current and improved holistic person-centered plan that reflects everybody's needs or the individual's needs, a detailed service authorization that reflects the assessed needs, and then a current budget that reflects the detailed services and it's authorized. So some of you may have participated in what we had done with the tracking when we had looked at personal supports and looking at billings through LTSS and where we are with some of that. So again, we will work closely with participants, the regional office, case management entities to ensure that we're meeting all of our timelines. Now, there's been some discussion about what does the budget look like. And I want to basically tell you that later in this presentation, you will hear that we will put the 4% COLA for all participants in immediately, and that we will work with the FMSs, and I believe there was a call yesterday afternoon to with the FMS entities to address this, to increase the availability of funds that you can self-direct in your budget. So again, there was some discussion, and when are we going to get our 4%? Are we getting a COLA? We can't see the COLA, but we will go back and work with the FMSs, and it will be done immediately, and it'll be retro back to January 1. So our goal is for people who self-direct their services to have a current PCP approved and a budget by June 30th. I ask for everybody's patience. We know that some of the person-centered plans don't necessarily have gone beyond the date, and we need to all work together and get this corrected so that we have a current person-centered plan and a budget for everybody who is self-directing their services. And again, also encouraging people who are either transitioning youth when they're coming out to basically offer self-directed services as well as traditional, and not just only traditional. So again, I want to thank everybody for your continued support and your ongoing communication and dialogue with me and with the staff in DDA. And with that, I will turn this over to Dr. Smalls.
Thank you so much, Deputy Simons, for your introduction. Good afternoon, and thank you all for joining our training today. As Deputy Simons indicated, the DDA remains committed to the expansion of the self-direction model and wants to be sure, DDA wants to be sure that you have the training tools you need to ensure your success. This presentation is one of several that will be made available to you as you have chosen to self-direct your services. Today's agenda for the presentation includes a basic overview of self-direction. It will then cover the PCP and budget development and approval processes, and will end with a brief discussion about your plan's implementation. We will take a few questions at the end of today's webinar. However, we will respond to all questions and upload the responses to the DDA website. It is our plan to utilize your feedback in the development of guidance and supportive tools to help you continue to self-direct your services successfully. Next slide, please.
Good afternoon, everyone. I'm Mary Ann Kane-Bresci, Director of Family Supports. I'd just like to say that, reiterate that Deputy Simon stated in his welcome remarks that DDA is committed to supporting you in directing your services and your life. You are the driver, and your team, made up of family, friends, neighbors, your CCS, support broker, whomever that might be, is here to support you to live your good life. At DDA, we believe that everyone has the right to live, love, work, play, and pursue their aspirations in their community. People lead whole lives made up of specific, connected, and integrated life domains that are essential to good quality of life, which include relationships, a sense of purpose, health and well-being, employment, safety, and living in the community. We also know and believe that people are the center of planning a vision for their personally defined good life, which is done through the person-centered planning process. Person-centered planning begins with knowing who the person is and those things that are and aren't important to them. And as a result, what do they want or not want in their lives? And also identify the goals that they might have. The person-centered planning process requires that the person and their team work together to identify and or develop the resources, supports, and services that will support them, the person, to live their good life. And the team does this knowing that people's needs and wants are met through a variety of resources, such as their own strengths and assets, relationships with families and friends, and other acquaintances, technology, community resources, as well as eligibility-specific services, such as DDA, in order to live their good life. Thank you. Next slide, please.
Good afternoon. Self-direction, sometimes called consumer direction or participant direction, gives you the freedom to choose the services and supports you need to live independently in your community of your choosing. The core functions of self-direction are choice and control over how your services are provided, who is being paid to provide these services, and what you want to pay them. Next slide, please. When you are enrolled in a DDA waiver, you are offered the choice to have your services provided to you under the traditional service delivery model, which is services from DDA certified or licensed community providers, or to choose to self-direct your own services within the self-direction service delivery model. Here, you are responsible for your budget and function as the employer of record. Next slide, please. When you choose to self-direct your services, you and those you have chosen to support you along with the DDA hold several key responsibilities. Called employer authority, you who have chosen to self-direct your services have the responsibility to recruit, hire, train, and supervise your chosen staff or providers. You and your chosen team will work with your CCS to develop your PCP and hold your annual PCP meeting. You will develop and manage your budget with the help of your CCS. This is called budget authority. Next slide, please. Your family, chosen friends, and other selected team members are responsible for providing you with valuable support towards the development of your vision for a good life. They may assist you in finding and utilizing natural community resources, but also to find employees and providers to address your needs. Your chosen family and selected friends may help you to discover and explore new community and employment opportunities to help ensure that you have options that you may choose from to ensure you live a meaningful life and not a service-directed life. Next slide, please. While your CCS has many roles and responsibilities, their key role is to assist you in finding resources in your community to help you live your good life. They will support you in developing your PCP, which documents your story, detailing your needs and wants, and what is ultimately important to and for you. They will help to develop and manage your budget. Your CCS is your direct contact, specifically assigned to help you navigate along the path towards your self-directed life. Together with the DDA, your CCS will monitor your overall plan's implementation. Next slide, please. While not required, you may choose to hire a support broker who comes alongside you to coach and mentor you in your role as the employer with strategies such as to find, hire, and manage your staff, to advertise, interview, schedule, train, evaluate, and handle employee concerns, to help you determine if your staff are providing services as you intended, and to review employee timesheets and submit them to the FMS on time. You will soon be able to search for and discover support brokers by going to the DDA website and searching the list by region and county. This list has been updated with support brokers' contact information and will be made available on the DDA website. Next slide, please. Choosing your employees carefully is important, as your hired staff and chosen vendors are responsible for providing services as outlined in your PCP and provider implementation plan, keeping up with required trainings and certifications, and they are responsible for maintaining an updated background check. Next slide, please. You may choose between two current fiscal management service providers who are responsible for supporting many of your employer-related duties, such as withholding and filing federal, state, local, and unemployment taxes, purchasing workers' compensation and other necessary insurance coverage, collecting and processing timesheets, calculating and processing employee benefits, such as sick or vacation time, and issuing payroll checks and tax statements. The FMS communicates directly with the DDA to obtain your authorized PCP and approved budget. As you are responsible for submitting your timesheets directly to your FMS, it is important that they maintain open communication with you as well. Next slide, please.
Good afternoon. The DDA is directly responsible for reviewing your submitted PCP, which upon approval establishes your total allocated budget amount for your chosen authorized services. DDA reviews your self-directed budget sheet and upon approval submits both the PCP and the self-directed budget sheet to the FMS before services become effective. DDA maintains communication with you, your CCS, and the FMS to ensure program compliance. Next slide, please. Everyone needs help sometimes. If you feel that your rights are not respected, or if you feel unsafe, it is very important that you let someone you trust know right away. Who you talk to is entirely up to you. Family or a legal guardian, your coordinator, or your support broker if you have one, or someone else on your team. You can also contact someone from DDA's team to assist you. You are responsible when you stand up for yourself, so don't ever hesitate to ask for help. Next slide, please. Again, within the self-directed services delivery model, you have both employer authority and budget authority. With employer authority, you make all decisions in the recruitment, hiring, training, and supervision of staff you've chosen to deliver your services. As the employer of record, you are responsible for ensuring that timesheets are turned into the FMS correctly and on time. Your CCS and support broker, if hired to support you, can assist you with this. Budget authority means that you decide what you will pay your chosen staff to deliver services within the established reasonable and customary rates. It is your responsibility to submit your budget and manage it to be sure that you stay within your amount allocated to you. Next slide, please. Today, we will review the overall plan and development process, which, with the help of your team, will result in your person-centered plans authorization and implementation. The goal here is to help you better understand and move along your path towards self-directing your services to help you live your good life in your chosen community. Next slide, please. We will begin with an overview of the person-centered plan and approval process. In our recent presentation on the PCP development and authorization process, we covered this process in more detail, but today we want to review it again to highlight its importance. Next slide, please. Simply, the PCP is your blueprint for your life. It supports you in taking control of setting your goals, making choices and decisions about your life. It builds upon what is and who is important in your life, and not merely developed to identify services and supports needed. It serves as a tool to communicate to your support team about your goals and choices in your life. And it can be revised as your needs and wants change. There is no longer the modified service funding plan process. This was discontinued on October 1st of 2020. This eliminates the extra review process and approval step, simplifying the process to getting the services that you need. It is important that you work directly with your CCS to ensure that there is supporting documentation for your request. As a reminder, you are always at the center of the PCP process, and you guide all aspects of the PCP development. The PCP is your plan. The PCP is about your life. The PCP reflects your choices. The PCP is not about your chosen vendors, providers, and staff. However, it does guide them in how, when, and where you would like to receive your services. This PCP is not about the CCS. However, it does guide the CCS in helping to identify resources, monitoring, and advocating on your behalf, and they are responsible for entering your plan into the LTSS Maryland system. Your PCP will be reviewed and developed at least once annually at your annual PCP meeting. But you can always revise your PCP at any other time if a change to your plan is needed during your plan year. You can reduce the need for revision by fully participating in your annual PCP development process and inviting those who know you best to assist you. Next slide, please. The planning process is so important for many reasons. In addition to encouraging teamwork, building trust through transparent communication, the planning process helps you to better describe your vision and the supports you may need to live your good life. A well-planned and developed PCP helps to identify what's needed and then determines the cost of providing those services, which you will then use to develop your own personal budget, which we will discuss later. Life gets busy and everyone has lots on their plates, but the PCP and the process associated with it is at the heart of what we do. It's a reflection of you, your goals, and the support you need to live your best life. It is critical that meaningful effort goes into the development of your story and the resulting robust PCP plan. Every year, the PCP team formally comes together, regroups, and fine-tunes the blueprint. Your CCS should be checking in with you at least quarterly so that a good summary of your status can be discussed. In the planning phase, the team comes together to talk about the past year, to plan and adjust as necessary. Don't rush this process. Take the time to think about what is and is not working for you. Some services you may have previously needed may no longer be a need. Maybe you have now identified resources right in your community that address your need. The focus area of explorations tool is helpful to use in the planning process as it prompts you and your team to think holistically about what you want your good life to look like. Next slide, please. Considering what's important to and for you can be very challenging. What you know and others may agree is important for you may sometimes outweigh what is important or really matters to you. Sometimes you may be willing to compromise this because of the specific things that are important to you in order to live a balanced and good life. The planning process allows you and your team to discuss this balance and create a PCP that holistically addresses both. Next slide, please.
Hello. I'd like to talk about person-centered planning tools, and there are many of these tools. I'd like to talk now about charting the life course, which is one. Charting the life course is a set of universal principles and tools. Its fundamental principle states that all people have the right to live, love, learn, work, and play, and pursue their aspirations in the community. Charting the Life course was developed by the University of Missouri, Kansas City's Institute for Human Development Family to Family program. Believe it or not, it was developed by people with disabilities and families who support people with disabilities. They developed it to help people with DD and their families create a vision for their good life. They wanted to help them to think about what they needed to know and do, navigate and or develop supports and resources, and finally discover what it's going to take to live their lives of choosing and be empowered to do that. Next slide, please. An example of two of the tools you'll find within Charting the Life course include the trajectory and the integrated star. The trajectory is one that can be used to help people think about and discuss those things that are important to and for them, and as a result, identify what they do and don't want in their lives, and to develop a vision for their good life, and what they'll need to move in a positive direction towards that vision. So some ideas might be a person may want to live alone, or they might want a job, meet new friends, have a romantic partner, take a vacation, or just learn to cook. In the development of the person's vision, challenges arise. They always do, and what to do about them. For instance, a person may want to acquire a job, or a person has acquired a job across town, but doesn't drive. How do you solve it? How do you begin to think about it? Well, a useful tool through Charting the Life course is the integrated star. This is a tool that can be used to think about all the resources, or even to brainstorm around that particular challenge regarding all the resources and supports that might be available, beginning first with the person's strengths and assets, relationships they may have, whether it's family, friends, acquaintances, past relationships, former teachers, so forth and so on. You want to consider technology, how that may or may not assist them, community, and all the resources. And when we talk about community resources, we're talking about resources that are available to everyone and anyone, and how and what role might they play in that person's life. And then finally, eligibility specific resources to address these issues and ultimately make it possible for the person to live their good life. This is just a very quick introduction into Charting the Life course. There's so much more. To learn more about it, please go to Charting the Life course Nexus and to learn more about, and the person-centered planning page. Thank you. Next slide, please.
As you heard Mary Ann discuss, several great tools that are helpful in developing a robust plan towards a good life, I am going to talk about the PCP development and approval process. It is critical that you begin the process by working with your CCS in the planning phase to choose your PCP team, begin gathering documents and resources, and meeting to begin to draft your plan. As part of the planning process, you and your CCS will use this earlier collected information to facilitate your PCP meeting, where you and your team will meet to review your chosen goals, your needs, and your proposed services. A careful review of natural supports and services that you have in your community should be considered. Your CCS works with you to enter the detailed service authorization section of the PCP in LTSS. This indicates specifically how much of each service is needed. The CCS is not responsible for determining the rates for your selected services, but they are responsible for entering how much is needed in terms of units into the direct service authorization section of the PCP. Take your time to discuss. Try to look at what a day, a week, a typical month might look like with the needed services. Is it realistic? Ultimately, once approved as part of your PCP, It will determine the budget amount that you will then use to develop your personalized budget, which we will discuss later. Upon receiving your approval or your authorized representative approval, if applicable, by signature, your CCS is then responsible for submitting your finalized PCP to DDA through the LTSS Maryland system for review. DDA then reviews, and once approved in LTSS Maryland, the initial overall budget allocation for funding of your requested waiver services is determined. Next slide, please. After the important work of developing, submitting, and receiving approval for your PCP is complete, the next important steps involve the development of your personalized budget, along with review and approval so that plan implementation may occur. Next slide, please. Budget development is the process following the approval of your person-centered plan by DDA, where you decide how you will use your approved allocation to pay for your identified support needs. An approved budget directs your FMS to pay for your staff and supports as outlined in your authorized person-centered plan. Next slide, please.
How do you develop your budget? With your CCS and your DDA approved budget allocation, you will complete a self-directed budget sheet to detail your PCP approved service, number of units, and rates of paying using reasonable and customary rates. You will use the allocated amount of funds approved in your PCP to determine what you pay per authorized service. Reasonable and customary rates establish a minimum and maximum amount that can be paid to your chosen vendors and employees for a specific authorized service. When self-directing services, you have the ability to negotiate and set the rate for the service, but it must fall within the range of reasonable and customary rates provided by DDA. This flexibility is actually a wonderful benefit for those who choose to self-direct. You actually maintain control. The DDA will be posting the new reasonable and customary rate ranges for your services on the DDA website by the end of January. Next slide, please.
The budget development and approval process includes the following steps. First, when using the PCP budget allocation, you and your CCS will complete your self-direction budget sheet. The budget sheet is being updated and will be made available on the DDA website by the end of January, along with user-friendly instructions on how to complete it. Upon completion of the self-directed budget sheet, your CCS will submit it to the DDA for review and approval. Your CCS will work closely with you to ensure that it is submitted in a timely manner. Next, the DDA will review, and when approved, DDA will send it along with your PCP to the chosen FMS prior to your plan's effective date so that services may begin on time. Your services should begin by your annual plan effective date. Next slide, please.
Cost of living adjustment, or COLA. COLA is added to the rates of services when approved by the Maryland General Assembly. These increased rates then increase the total of your approved budget. A COLA can be used to increase your allocation for increasing wages or services. DDA was approved to add a 4% COLA to services effective January 1, 2021. Next slide, please. To immediately apply the COLA for all participants, the DDA will work with the FMS to increase available funds to self-directed budgets. The FMS will work with each participant to add 4% increase into their budget. Budget modifications only need to be submitted to DDA for this increase if a new service not previously authorized is added based on the increase, and secondly, the overall changes to service increase to the total budget by more than 4%. DDA and your FMS will contact you via email about how this increase impacts your individual budget and the steps to applying the increase by early February. Increases to budgets will be backdated to January 1, 2020-21. Next slide, please. Per the December 21, 2020 guidance, the DDA is working to ensure all participants using self-directed services have a holistic, quality, and detailed person-centered plan in LTSS Maryland. As plans are approved in LTSS Maryland, the COLA, which has been applied to the rates in LTSS Maryland, will be reflected in the budget allocation developed through the detailed service authorization. When the new budget allocation is established by the approved PCP, then you will need to create a new self-direction budget sheet. Participants will work with their CCS to update their self-directed budget sheet and submit to DDA for review. Next slide, please. From January 20 through January 2021, all participants self-directing services will either create a new or a revised or annual plan. The DDA is committed to reviewing and approving plans during this time frame. The approved budget plan or the approved plan budget allocation is then used to create the self-directed budget sheet that is reviewed and approved by DDA. Next slide, please.
While all aspects of the PCP and budget development and approval process are crucial, the DDA is committed to ensuring that your plan is implemented and that you receive the services that have been authorized. Your CCS will work closely with you to monitor compliance and quality of service delivery and plan implementation. Next slide, please. After both the PCP and budget have been approved, it's time to ensure that the FMS receives both and performs their administrative functions to get your chosen employees set up for payment. Again, they will send regular statements which will assist you in managing and staying within your approved budget. The DDA is working with the FMS to develop user-friendly guidance on how to read and understand your statements. Next slide, please.
So moving forward, let's review a few summary points. An immediate COLA will be applied. DDA will work with your FMS on applying the 4% COLA back to January 1st, 2021. This budget will be used until your new PCP is developed in LTSS Maryland. Please contact your regional office to verify that your current email address on record is correct, and communication about the rate increase will come through email from DDA and your FMS. Per the December 31st, 2020 guidance, DDA regional offices and CCS agencies will work with you to review, revise, and/or develop a new PCP using the detailed service authorization to develop your budget allocation. Future communication will be ongoing to the tracking and completion of all PCPs and budgets. Again, the DDA is committed to improving your understanding of how the self-directed model of service delivery works, and will continue to refine and provide tools to help you navigate your role in self-directing your services successfully. Your feedback continues to be important in helping us to reach this goal to support you. Follow-up documents, including the Self-Directed Handbook, which is a partnering guide to help you and your family self-direct, will be made available soon on the DDA website, along with several other documents. One, we are going to be providing training, which includes a walkthrough of how to complete the self-directed budget sheet. You'll receive updated reasonable and customary rates, which will be located on the DDA webpage. There will be training on how to review your budget statement received from the FMS. A lot of questions have come around that. And the website will also have a regularly updated support broker list if you choose to identify one to support you, to help you exercise your role as the employer. Additional trainings based on your feedback will be developed, but we want to make sure that you have access to them and the opportunity to ask questions if you have them. Next slide, please. Again, we repeat that we are committed to you being successful in self-directing your services, and will continue to provide additional resources to you and your family, identified by your team members and by those who are committed to supporting you. Some of the noted resources on the website include the LifeCourse Integrated Supports STAR link, Maryland's Long-Term Services and Supports Person-Centered Plan Overview. There's a PCP CCS guide, and several other documents that will be helpful not only in the development of your person-centered plan, but also to the development of your self-directed budget and the process in submitting, seeing those approved, and then seeing those plans implemented. Next slide, please.
Okay, now we're going to open it up for questions. And so I have a question for Mary Ann Kane-Brushy. What is the difference between a holistic PCP that builds strategies considering all needs of participants and identifying resources in PCP summary in the LTSS, which seems to only address the DDA resources point of integrated supports?
Patricia, I'm sorry, could you repeat that again? I just want to make sure I understand. I guess specifically the second part of that question.
It's really about that the LTSS focuses only on addressing the DDA's resources point of integrated start of supports. So on the ground, there is no time or support given to participants to develop a holistic plan with an integrated supports to all the points on the start. So can you talk a little bit about what does it mean when we talk about a holistic PCP?
Sure. It's a great question. And I think going forward, the intention truly is to have opportunity to develop holistic plans. What is wonderful about, first and foremost, is the vision and getting to know the person and taking time to know who the person is. These tools help to guide those conversations. Once you know who he or she is, what's important to them and for them, and discussions around those, and begin to develop a vision for that. And as I mentioned earlier, as you develop a vision, challenges emerge immediately, right? They always do. You can then use that integrated STAR to think about all resources. So there's nothing about LTSS that limits a conversation around all of the resources that might be available to someone. Again, first and foremost, we begin with the person. So, but there needs to be support in how to have these conversations, and that's what we love about these tools, is that there's so much support around that, and provides guidance around questions and things, ways to think about it. So again, the first resources we think about the person and what he or she brings to the equation, right? Then we think about those relationships that he or she, and again, LTS doesn't limit any of that, and it doesn't limit the discussion around technology.
Thank you, Mary Ann. I have a question for Rhonda Workman. Is there a limit to the amount of hours an independent support broker is allowed in a participant's budget? And what is the limit to independent support broker's fee if there is one?
Now, that's a great question. And so as noted in our approved programs that's listed on our website, initial orientation and assistance by a support broker is available up to 15 hours. And then monthly information, coaching, mentoring of up to 4 hours per month is permitted unless otherwise authorized by the DDA. And in terms of the rate, that would be noted in the reasonable and customary range.
Thank you. I have a question for Ron Peely. Have reasonable and customary rates been updated recently? And if not, when do we expect them?
We, as was pointed out in the during the webinar, we expect to have those on the website by the end of this month.
Thank you, Ron.
Yeah.
In this, go ahead. You have something else? Is the this one's for you too, Ron? Is the automatic COLA calculated using the current total approved PCP budget amount?
So can you repeat that? I didn't hear the first part, Patricia. I'm
Is the
sorry.
automatic COLA calculated using the current approved PCP budget amount?
Yeah, so the COLA will be applied to the current budget for those budgets that we're working with the FMSs on now. As Bernie mentioned earlier, retroactive to January the 1st, the 4% COLA will be applied to those budgets.
Thank you. Dr. Smalls, this is for you. How is the budget submitted to the DDA after the PCP is approved?
That's a really great question. The term approved, when we talk about the PCP, usually means the DDA has reviewed the document in LTSS and clicks an approve button. What our process will be is a review of the actual PCP, and if it meets all requirements and tells your story clearly, and there's supporting documentation for the services requested, the DDA will reach out to the CCS requesting for the budget sheet to be uploaded to LTSS. That is the final step in the formal approval of the PCP. So the DDA will be reviewing that budget sheet, and if appropriate and aligned with what has been initially approved in the PCP document, the entire PCP will be authorized, including the services identified in the budget.
Thank you. This one's for Ron. What happened to the COLA that was effective July 1st, 2020?
The 8 participants should have received their COLA for the FY 2021. So if there are any anomalies or questions or issues with that, we'll take a look at those. If individuals want to send, we're looking at that also with our FMSs to look at what the current budget is relative to those kind of concerns or questions. If someone has a question about the FY21 budget relative to 4% COLA, they can, email myself, or they can email Natoya or someone in the regional office so that it gets to me. But we're looking at those as well. looking at the ones where folks think that they haven't received their COLA for FY21 as of July 1, 2020. And if indeed, it boils down to that a COLA hasn't been applied, we'll address those.
Okay, so in summary, if you have a question about your July 1st, 2020 COLA, and you don't think that you have received it, you're to contact Ron Pilley or the regional director or Natoya so they can follow up and see where that's at. All right, thank you.
Correct. Thank you.
I have a question for Tina. After the CCS submits the new plan to the DA for review, how long is it typical for the DDA to review and approve a plan? What is the time frame?
Typically, DDA has 20 business days to review a PCP and make a decision on the approval. Sometimes we need to get clarification on something, so we might submit a clarification request back to the CCS for additional information.
Thank you. Rhonda Workman, can family members get paid for their work in self-directed services? Can they become paid providers of any service authorized in the PCP?
Yeah, that's another good question. Family members and relatives and legally responsible individuals can provide waiver services. However, that is not an option for all of our waiver services. As we noted in the waiver application that's been approved by CMS, there are specific services for which a family member, a relative, or a legally responsible person can provide those services. And so I would refer you to that, to the waiver program to clarify. Your CCS, your Coordinator of Community Services, and the regional office self-directed leads could also assist you with that information.
Thank you. This one is for Dr. Smalls. When will the DDA coordinate support broker trainings across the regions? Are there any plans for new support broker recertification and ongoing expire? We were told to email Natoya Mitchell to request an extension for the support broker expiration date. Can you give us any update on the next steps?
We realize that some time has gone by since there's been new research training for support brokers and the opportunity for new brokers to join us. So we have worked together to set a few dates for upcoming training, both for new support brokers to go through training as well as recertification. Those dates will be sent out by the end of the month, but several dates are identified so that there are multiple opportunities for new people to walk through the training and potentially join us as support brokers.
So in summary, you have dates that will be advertised for training for both initial and ongoing support brokers that'll be going out this month, correct?
Yes.
Thank you, Dr. Small. Dr. Smalls, don't go away. I have one more for you. DDA, we have on a statement on one of the slides that it says DDA in your FMS will contact you via email about this increased impacts for your individual budget and steps to apply the increase by early February. Does this mean we cannot submit budget modifications to the FMS allocating the COLA funds to a line item in the budget until we receive an email from DDA or the FMS instructing us to do so?
That is a multiple part question, and it's a really good one. There are very specific steps that we want to make sure are very clear for all of you in being able to receive and utilize the 4% COLA. And what I'd like to be able to do is ensure that that is in response to the questions that are coming to us, put that in writing to ensure those steps are uniform and clear. I don't want to misstep in sharing what some of those are now because that falls a little bit out of my purview. But we will make sure that those steps are clearly identified and shared with each of you so that you're aware of how that COLA specifically will be applied, which is also indicated in the slides.
Thank you. This is one more for you, Dr. Smalls. Are there still rules on what COLA can be used for? Can you provide a link with that information?
Yes, excellent question. I think one of the things that's going to be really important as we prepare and finalize the self-direction handbook are questions like this. We want to make sure that you're very clear on how the COLA can be used, what services it can be applied to, and what services it cannot. That information will be provided and updated in the self-direction manual, which will be prepared for upload by the end of January, which is next week.
Right. And this one is, I am only a staff worker, but have been given duties of a support broker for almost 2 years now. What it is that I can do to move forward. I'm interested in becoming a client support broker now. And what are my limitations for becoming a support broker or something else in that nature? Dr. Smith?
It sounds like you've had a little opportunity to practice some of the roles and responsibilities of a broker. It's really important, however, that you go through our formal training, which I mentioned that new dates are going to be set up for newly interested folks that are interested in becoming support brokers. So when those dates go out, I would suggest you immediately getting signed up so that you can get the formal certification to allow you to function in that role if a participant has chosen you to do so.
Okay. This one's for Rhonda Workman, but I'm going to read it, but I'm assuming the person's talking about support broker. What information and how does DDA use the information to determine how many hours a participant service a person can receive?
That's a great question. So currently, based on the functions of the support broker to do information, coaching, and mentoring during the month, that's where it was determined that 4 hours per month was needed. We do have the ability to approve additional hours, and we would do that based on, extraordinary circumstances, maybe changes to the person's health and welfare. And we have some of that information noted in our waiver application that says additional assistance, coaching, and mentoring may be authorized based on extraordinary circumstances when there are significant changes in the person's health or medical situation.
Okay, here's another one. Our family has been thinking a lot about how our daughter can continue to have a self-directed life when we are no longer here. Who will be the mom? I currently help my daughter to manage her schedule and details of daily life. When I asked someone about this from DDA a few years ago, the response was that my daughter would have to move from through a self-direction to a group home. Is DDA planning to offer guidance and professional support to families in our situation? Absolutely. You heard the Deputy Secretary said that he really wants to expand and enhance self-direction. A person can self-direct with the proper supports. We don't think they need to be in a residential setting to do that. So I think that is a great question. And I think DDA will continue to engage with families who want to plan for the future for their daughters. I don't know, Mary Ann, would you like to add to this?
Yes, thank you, Patricia. Absolutely. And I think for the family, so we're talking about the vision and the plan for the person, but for you as a family, what is your vision? and about supporting your loved one after you're no longer here. And there's a lot we can do to use the Integrated Start to begin to look at those resources. And I'd love if you'd be interested in reaching out to me to help you with that, to begin to consider those questions, but at least for now, anyhow. But yes, there's much we can do.
Thank you. Thank you, Marianne. Dr. Smalls. So we have to do all PCPs for participants by June 30th, even if they're not due during this time period. Can you explain that a little more? You're unmuted, you're talking, Dr. Smalls. Oh, did we lose it? Rhonda, can you answer this question?
Yes. So in terms of the PCPs and the information we shared today, from January till June, we are going to be teaming up with team CCSs and providers and participants to make sure that they have a current and accurate PCP that reflects their needs and that they have a budget that has been allocated and approved. So we know over the 6-month period, some people will have their annual PCP completed during this time. And those that do not, knowing that our CCSs are following up with individuals quarterly and even more frequently now with wellness checks because of COVID, as we're working through this process, if a revised PCP is needed, then we would be working with the individual and the team to help facilitate that. So yes, our intent is to review all PCPs for people using the self-directed service delivery model over the next 6 months, using our experience from our review of personal supports over the last 3 months.
Thank you. Jana or Tina, this one is, how do the participants receive a copy of what was submitted in the system? We have CCS make changes to the wording submitted in the system. So how do they get a copy of what's submitted in the system? Jana?
Yes, the CCS could provide a copy, or they could reach out to the regional office, and we could also provide a copy of that PCP.
Okay, thank you. Will the communications include instructions on what forms to use to allocate the COLA? Dr. Smalls? I think we might have dropped her. Ron?
Can you hear me? Can you hear me?
Yes, we can. Yes, we can.
Sorry. Okay. So the question was, can you repeat the question?
Will the communication, it's okay. Will the communication include instructions on what forms to use to allocate the COLA?
Oh, absolutely. As Ron discussed in the presentation earlier, we're going to make sure that it's very clear how the COLA is applied, and that for existing current budgets and those moving forward.
And I just wanted to add to this is that Valerie, Roddy, and I met with the 2 FMS agencies, and they're aware of what we're doing. This is why we put in the slot to contact them at the end of the month. That's when they'll have the list of the people with their COLA information. And then the FMSs are going to work with each of the participants on applying that COLA for a specific service. So the FMS will be working with you hand by hand to make sure that you have that information and those instructions. So it's a partnership between the DDA, you all, and the FMSs. So does the PCP clarification process add another 20 days to the PCP approval process, Rhonda?
So once the PCP is submitted to the DDA through the LTSS system, the DDA will get an alert that it's there, and then we will then review it within 20 days. Our review will result in either a clarification to the CCS asking for additional information or clarifying something that was in the PCP, or a determination, meaning whether it's the PCP is authorized or denied. Any denied PCPs will receive an appeal letter with their rights.
Okay, and this one is for Ron. Is the reasonable and customary rate going to incorporate with the COLA?
So the reasonable and customary rate will, because it's based off of our traditional rates, and it gives a range for participants to choose from, in terms of what they pay for the service or what they pay, their support staff.
Thank you. Rhonda, can you explain a little bit about how does payment for support workers come out of the individual's budget and why?
That's another good question. So for all the waiver services, right? So whether it's support broker or employment services, community development services, personal supports, those all come out of the person's allocated self-directed budget. So support brokers, even though it's an optional service, it is a waiver service and therefore would come out of the person's budget.
Okay, thank you. This was another one about the budget for you, Rhonda, because it's to do with services. If budget savings is used for music activities with documentation need and in the plan, is there a limit to the amount in the budget savings?
But that's another really good question. And so for the callers on the phone, we have a service that's available only under the self-directed service delivery model that's called Individual and Family Directed Goods and Services. It is limited to up to $5,000 annually, and that funding, that limit, has to come from the savings from a person's self-directed budget allocation. What that means is, as a person self-directed, having that employer authority that Tina and Jonah talked about, you have the right to identify the wages, excuse me, that you are going to pay your staff. You may pay at the lower end of the reasonable and customary range, which may equate to a savings in your overall budget. That savings can be used for things like music activities and such that would be noted under the individual and family directed goods and services.
Thank you. I'm going to read this one first, and then we can see who can best answer it. This is a situation where a family member is already in place as a DSP, and there is no need to recruit. What challenges do you foresee in moving to self-direction? So let's start with Dr. Smalls, and Rhonda, if you have anything to add.
So you're saying that you already are functioning as a DSP for your loved one, and you're considering transitioning to the self-directed model, which if that's the choice that you want to make, it's a good one and it's an easy one. More of what we want to make sure is clear are the roles and responsibilities of that DSP, since as a family member, we have to identify a payment structure. Rhonda, would you mind adding to that?
Yeah, I would say a couple things. So if a DSP is currently providing services under the traditional model, then what you want to look at, if you're changing to the self-directed model, confirm that that service allows a family member to provide it. And then you would want to coordinate to access the self-directed service delivery model. You could establish a support broker if you want as an optional service, but you would identify your fiscal management service provider. Currently there are 2 available. And then you would be sharing the information about the family member to the FMS, who would then need to establish that family member as an employee of you, and then would gather the required documentation for CPR, first aid, background check, and such. And so it would be going through the process, but first I would suggest you confirm that the service that you are seeking to self-direct does support the family member as a provider of that service.
Thank you. Rhonda, can a family member be a support broker?
A family member can be a support broker.
Thank you. So yes. Okay. A lot of them is about when is the next support broker certification. We are putting that out via Constant Contacts. We're hoping to get it out by this Friday so that you would know when we're doing it. It's going to be virtual, so we're not going to do it by regions. We're just going to do it across the entire state. Rhonda, can anyone self-direct without an authorized representative?
Yes.
Okay. How does DDA decide how many hours of personal supports or CDS services they can receive? Marianne?
I think I'd like to defer to Rhonda on that one, if you don't mind.
Sure, absolutely. Let me provide some information, and then maybe Tina would like to add. But so what we're looking for in terms of a person-centered plan, and I believe Tina or Jonna shared it, is really looking at the day and looking at the week and the month. So what are the services that you're seeking to receive? And then, you know, looking at maybe developing a schedule. How many hours a day? What's the activities that you're going to do, whether it's an employment service, a community-based service, or personal support services. And so we're going to look at that information to see, one, if the service is reasonable, right? We wouldn't expect to see a lot of, 24 hours of services for employment services and such. So what's really that schedule looking like? And what are the activities to make sure that they are things that can be supported through the waiver program? Based on that and seeing the assessed need, then we could look at the authorization of those units and hours. Tina, do you want to add to that?
No, I mean, that's pretty much how we look at things. You know, we look at what somebody's day looks like, what other resources they're using, either natural supports within their family or state plan services, if they receive CFC services, and, you know, where the gaps are and what they want to do during that time.
Right, thank you. And Tina, who should a person reach out to discuss future planning and staying in self-directed services?
So when we talk about future planning, are we talking about, are we talking about somebody who might have resources that they need to, you know, set up some kind of ABLE account so that they can maintain their waiver eligibility? I mean, there's all kinds of future planning and resources and things. You know, I think a CCS is a good resource to look for or to go to begin to talk about that. But if we're talking about staying in self-directed services and how do you do that once your family members may not be around, you know, I think it's always good to start planning about that before the crisis happens. So that you have a plan in place and aren't reacting to the crisis itself. So, you know, use your family that's there now and begin planning so that you can continue to self-direct your services if something should happen to your family. And there's lots of resources available out there, whether it be an ABLE account or some kind of a state special needs trust, you know, just depending on your particular situation.
Thank you. And this could be for Jonna or you, Tina. Does the individual family directed goods and services have to be used, has to use savings accumulated in the budget sheet or shift money from one category of service? Is that okay? Anybody? So Rhonda, do you want to answer this one?
Patricia, can you do it one more time? I was trying to respond to other questions.
Does the individual family goods and service have to be used, the savings accumulated in the budget sheet, or shift money from one category of service? Is that okay?
Well, it should be a savings, but currently we do, I support that people can shift funds from one source to another. Now, keep in mind that when you create your annual plan, that it's based on an assessed need. And so in your annual plan, we should not see any savings or any funding for the individual and family directed goods and services, with the exception of the $500 that DDA has said that we would dedicate to staff recruitment for people self-directing. Other than that, the plan must be implemented in order to achieve some savings in your dollars, in your budget, to then be able to use it as individual and family directed goods and services.
Rhonda, can you talk about the SIS and the self-direction services?
The SIS?
SIS, supporting the scale?
Yep. So the DDA utilizes a tool called the Support Intensity Scale, and it's used to help facilitate some person-centered planning and thinking in terms of services and supports an individual would need. So all participants, regardless of the model that they're using, we seek to have a support intensity scale completed to help inform the individual and the team of some supports and services that may be needed. And you can use that information to create the plan and then also consider for your budget.
Rhonda, how does someone in self-directed services get overnight personal support if it's needed for health and safety?
So that's another really good question. And within our waiver program, we have a variety of service models to meet different needs. Under our personal support service, this service has been noted in our waiver program as a habilitative service. So it helps people to learn new skills, maintain skills, teaching skills, and we have noted personal supports to be in-home skills development and community engagement and integration. Therefore, personal support should not be sought if you're needing overnight supports to support a person in terms of medical or behavioral challenges through the night, as those would not be considered habilitative skills. We do have a service called supported living, which provides up to 24/7 supports in a person's own home, which is very similar to our residential model of a group home. And that's where we could offer those overnight supports.
Okay. Jana, this is for you. How long does it take to make a transition from traditional DDA services to self-directed?
So that really depends on the individual and their team and how long they take to go through the process and think through things. There's a lot of decisions to be made when you change to self-directed services. So it really depends on the person and their planning process.
Thank you. Rhonda, can a support broker provide both personal support and broker work?
So that is a really good question. And under normal times, non-COVID public health emergency time, the answer to that question would be no, because a support broker in their role of mentoring and coaching an individual about employer-related responsibilities should not then also be having a coaching and mentoring role related to a service they're providing. However, under the COVID-19 public health emergency, as noted in our federal emergency approval of what's called an Appendix K emergency, we have noted and received federal approval for a support broker to be able to provide personal supports and support broker services if the individual chooses, and this may be a choice because of challenges with identifying staff during this time. So it is only available during the public health emergency as an exception.
Thank you. Dr. Smalls, this one's for you. When will CCS receive notification that PCPs need to be revised due June 30th?
We're in the process of putting together the documentation for that very clear indication of when those reviews are due. Bear with us. It has been created, just needs to be shared with the CCS agencies.
Thank you. And this one, it has to do with the budget, and it says the budget amounts in the detailed service authorization are very high. How is DDA accommodating for these huge increases in funding amounts?
So
Ron,
this is
do you
Rhonda.
want? Okay, go ahead, Rhonda.
So this is Rhonda. I would just say a couple things. You know, the funding allocation based on the detailed service authorization is there so that participants self-directing can utilize based on what they see is needed. We provide that range for reasonable customary rates as an option. The budget allocation through the detailed service authorization does not mandate or require you to use all those funds. So the budget that is there is based on a fair and equitable model with the traditional, so you can look at that. The funding from the budget, I would refer to Ron for his answer.
Yeah, I mean, and the funding in the detailed service authorization is based upon the rates that are in LTSS, which are going to be different from the rates in PCIST. Yeah.
Thank you, Ron. Rhonda, if a person, there is a person who their guardian is refusing to complete the SIS, what can be done?
So that's a really good question. For that, I think we would need some additional information related to it to see what assistance could be provided. Disability Rights Maryland and the Legal Aid Bureau could provide assistance if there's concerns related to that, but we would need some additional information. So I suggest reaching out to the regional office for assistance.
Okay, thank you. So there's a lot of questions about supported living and people in self-direction and how supported living is not a service that people in self-direction utilize. How can people in self-direction use supported living to get 24-hour support? Rhonda.
So that's a good question. Supported living is a service option that is available in the person-centered plan detailed service authorization. There are a number of individuals exploring and working with current supported living providers in terms of establishing their own home and receiving the support up to 24/7 in their own home. There are some individuals that are coordinating with other people and looking at roommates and options, so that can be considered and explored. So I would suggest that if you are interested, talk with your coordinator of community services and get that list of approved supported living providers and reach out to them for assistance in terms of, you know, looking at roommates or options or apartments and the services that they offer.
Okay, this is more of a statement, but it's worth mentioning because I think it's important. And this person said, I think people need to understand that if they broker and they do DSP work, they can only get paid the DSP rate for the position they are covering and not the broker rate. So they're just saying, you know, just be very careful. The different duties and different job responsibilities and titles come with a different rate than others. And I think you need to make sure you identify that in the plan. And that's between the person who's hiring you and the person who's the employer of record in the budget authority. Great point, thank you. Go ahead.
I was just going to add, Patricia, that important point is specified in the DDA guidance for Appendix K posted on our website related to self-directed service delivery options.
So a lot of people keep talking about what the DDA website is. Donna, can you just go and flip us to the DDA website so people know where they can find the information on the screen? If you can do that, Donna, for the group. What's the DDA website? People want to know what that is. So if you can just put on the screen and bring us to the DDA website so people can see it. We have about 5 more minutes, so I'm going to continue reading the questions. Thank you, Donna. But I just want to walk you through. So the DDA website here has information about self-direction and everything that we're talking about. Any kind of Appendix K flexibilities is under the COVID-19 information. And if you click there, Donna, it brings us to Appendix K flexibilities. And where it says DDA Appendix K, you click that and you'll see what Rhonda talked about and some of the things that we can do. There's specific information of where we are. And so that is our website. So if you look at dda.health.maryland.gov, we'll bring you to our website. So thank you for asking that. That's a really good question. We sometimes assume people know everything about DDA, and that's not the case. So thank you for that. So Dr. Smalls, where or when can we find a list of support brokers?
So that's a great question. One of the things that we've been discussing regarding the DDA website is making it user-friendly so that you're able to find what you need. And so what we're in the process of doing, and we'll have uploaded by next week, end of January, is an updated list of all of the support brokers by region and county, so that if you're deciding that you'd like to utilize them as a resource as part of your person-centered plan, you'll be able to search by your region and specific county for which brokers are actually certified to support in that county. So that's going to be uploaded to the DDA website on this page by next week.
Thank you. Rhonda, is it possible to hire staff for supported living under self-direction under employer authority?
So that's a great question. And the answer is no. For supported living, this service has budget authority. However, you can reach out to a supported living provider and coordinate with them to see if they could hire a staff member that you're interested in, and they could become part of that agency's staffing and provide that service.
Wonderful, thank you. And so we have about 3 more minutes. So one of the questions that are being asked here is, are all the questions being recorded and documented being developed with answers? That is an awesome question. One of the directives from the Deputy Secretary is that he does want us to make sure that we answer all the questions, and he also wants us to follow up with all of you as to the process, making sure you're kept informed of where we are with the PCP and budget approval. So we will be creating an FAQ just for self-direction and what's coming out of this specific webinar today and the task ahead. So the answer is yes, we will be doing that. One other question, there's a couple of things about the DDA vaccine. I wanted to let everybody know that people in self-direction, since on Monday we started 1B, the participants in self-direction are under that category. So yes, you should be able to contact your local health department and do a pre-assignment or assignment. Each whole local health department is doing something different, that you are in that category. So I'd encourage you to move forward with that. So it is now 1 more minute. I can read one more question here. And there's a lot of questions about supported living and self-direction and overnight. And so I think what we need to probably do is provide a little guidance about people who need 24-hour support when it has to do with health and safety. There's some very specific requirements under the waiver where the person lives and with whom they live. So we'll have to provide additional information on that for you all. And I think that brings us to an end with our questions and answers, and then we will make sure that we will answer all the questions. And then to all the people that signed up here, you'll get the answers to the questions, and we'll also will be posting them on the DDA website. So thank you very much. Stay healthy, stay well, and thank you for joining us. And please know that you're welcome to join any of the webinars we're doing on this at Central, at Southern, at Eastern, and at Western. This was specifically for you as a participant and family members or siblings, but it'll be the same information. The other one would be just more detailed, more to the case manager and the provider and what they have to do. So thank you all, and really appreciate your involvement in wonderful questions. Bye-bye.